Therapy documentation has been at the forefront of medical review scrutiny since the inception of the Home Health Prospective Payment System in October of 2000. Stay tuned to learn more about improving your therapy documentation. Documentation is at the core of compliance, patient satisfaction, patient care coordination, the quality of patient care, and reimbursement. Home health agencies must understand what auditors are looking for in order to ensure that their documentation will meet the standard. The first element of therapy documentation we're going to discuss today is the initial therapy evaluation. The initial therapy evaluation is to meet two important elements. First, to establish the therapy skilled service needed, and secondly, to establish the ongoing treatment plan for future outcomes. The initial evaluation must be a full, comprehensive assessment of the patient using interview, observation, and hands-on assessment. The initial evaluation is going to feed the treatment plan that will be the core of the treatment provided to the patient throughout their care. You must be very detailed, have measurable, objective data, using the prior level of function to establish their current baseline and to set both short and long-term goals that will be necessary in the plan of care. The second element we're going to discuss today is the plan of care goals. Are they attainable? While each and every plan of care is required to have both short and long-term goals with a time period and an expectation that they will be met, it is very, very important that the documentation surrounding those goals makes it attainable for the patient to accomplish. They should be very individualized to the patient and not vague, generalized goals that would be used for all therapy patients. It is very important that on each and every visit note, you are documenting the progress that the patient is making toward reaching those established goals. Each and every therapy visit note should include not only the therapy skilled service provided, but in cases of education and training, there should also be documentation of what was taught and the patient or caregiver's ability to return demonstration, documenting their understanding and level of recall of what has been taught. Each and every note must provide not just what the patient's activity was that day, but the actual skilled service provided by the therapist. In any cases that you have noticed changes or any abnormal findings in the patient's care, those should be appropriately documented in visit notes and an action plan to correct those for the future. Patient communication and collaboration are imperative in ensuring a cohesive, comprehensive medical record of the patient. Collaboration will improve the quality of care and will ensure that quality outcomes are accomplished that now impact not only the Care Compare outcome measures, but the expansion of the home health value-based purchasing model that began January of 2023. When we talk about the timeliness of the documentation, it is important that your clinicians understand that the closer to the time of the visit that they finish or finalize their documentation, the better. It is important that things are not missing from the documentation and that the documentation is present in the chart so that caregivers that continue to see the patient for subsequent visits will know exactly where we are in the process of the care plan developed for the patient. These are some of the top recommendations for improving your therapy documentation. This will help to ensure that you have accurate documentation that will feed the quality of care, patient outcomes, and impact your reimbursement positively. Healthcare Provider Solutions stands ready to assist in any way that you might feel necessary to help your agencies accomplish the best when it comes to documentation, quality of care, and patient outcomes. Give us a call for more information on how we can assist.